What are dental implants?
Dental implants are screws made of titanium, which is revolutionizing the way in which tooth replacement is being carried out today. When a tooth is missing, or multiple teeth are missing, or all your teeth are missing, what we can do is we can fix these screws into the bone, the jaw bones, and these anchor your prosthesis. It could be a single crown, or it could be a bridge, or it could be the whole denture itself, or replacement of your entire dentition can be done today with dental implants.
Dental implants for single missing tooth.
When you have a single tooth which is missing, traditionally we were carrying out what are called as bridges, where two neighboring teeth used to be filed, and to that we used to fix crowns which would have basically a tooth attached, and that is what which was called as a bridge. In this, unnecessarily the two neighboring teeth had to be cut and filed across. Now with dental implants, we can basically fix this screw made of titanium directly into the area where you have lost the tooth. And once this dental implants get integrated into the bone, that means that it becomes a part of your bone itself. To this we can fix another structure which is called as an abutment, which jets out of the gum, to which you can directly fix a crown. So in this way, you're not basically touching your neighboring teeth, you're doing a tooth replacement directly by fixing this dental implant into the area where the tooth is missing. This is the closest replacement to a natural tooth without touching or taking support from the neighboring area.
How dental implants play a role in replacing multiple missing teeth.
When multiple teeth are missing, a good assessment has to be done to see if the quantity and quality of bone which is available there is good. If the bone is sufficient, then we can do a very simple surgical procedure wherein we basically make a small hole in the gum and a hole in the bone and drop these implants in. And this usually takes a few months for the implants to get integrated, and once they become a part of the bone, then we can fix crowns directly on these implants. So you don't take any support from the neighboring teeth, but directly you anchor these teeth which are missing by placing implants into the jawbone itself.
Are dental implants a solution for full mouth rehabilitation?
When all the teeth are lost, that is called as edentulation. That means that there is no teeth at all. Traditionally, the treatment has been the construction of a denture. The dentists were basically giving a removable full denture, which you might have seen in the previous generation of patients, or in your own family, your grandparents using dentures, which they would take it out and keep it in a glass of water or in a box next to the bedside at night times. Now with dental implants, we have completely revolutionized the way in which edentulation or missing teeth can be replaced today. When all your teeth are missing today, we can put multiple dental implants into your jawbone. Taking the support of these implants, we are basically constructing a bridge which is fixed into the jawbone itself. So it replaces all the lost teeth, and it's the next best thing to your own natural teeth.
How many dental implants are needed to do a full mouth rehabilitation?
When all your teeth are lost, there are different techniques by which we can actually do. Traditionally, we have been using 6 or 8 implants into each jaw. These basically take the support, and then you are fixing a bridge on top of that. However, with newer technologies coming in, we have a concept called as all-on-4 concept, where we tilt the last implants at an angulation. The two central implants are basically straight and parallel, while the distal or the last implants in the mouth are slightly at an angle. Based on this, we can give a full bridge having about 12 teeth on your 4 implants. In the lower jaw, there is even a newer technique which has been introduced recently, which is called as the trefoil concept, wherein 3 implants are just placed in the front portion of the jaw, and that is where you can use these 3 implants. These are solid 3 implants which go into the jawbone deep inside and support the entire bridge.
Are dental implants a solution for loose dentures?
Well, if you have very loose dentures, that means that the jawbone is basically becoming smaller and smaller, and what we call as atrophy. that means that the bone is getting resolved. And this typically happens when somebody wears a denture, and in about 5 years' time, because of the constant pressure which comes because of the chewing of food, that is directly transmitted to the surface of the jawbone. So the jawbone starts melting and your denture starts becoming loose. Eventually what happens is the bone loss is so significant, your denture will not be retained inside the mouth. And that is where you may have to go in for implants. And there are two ways in which you can basically have. You can anchor just a couple of implants, 2 or 3 implants, and have a ball and a socket arrangement or a bar attachment wherein your denture can be clipped on to these implants. But still you have a denture still with that. Or you put in multiple implants, and with this you can give a completely fixed option where you can do away completely with your dentures. So based on 6 or 4 implants or 3 implants, many times you can give a fixed bridge directly per jaw.
How long do the implants last?
Once the implants have got integrated into the bone and the crown or the prosthesis has been fixed, generally it lasts for many years. The first implant, which was placed by Professor Brennemark in 1964, lasted on his patient till 2004. So, it's a long-term solution. However, to make this long-term implant to be there in the jaw, it's absolutely important that the patients basically take care of their oral hygiene. Hygiene is the most important thing. So brushing twice a day, using an interproximal brush or using a water pick can make a big difference in terms of the maintenance phase. It's also important that you go for regular checkups, maybe once in 6 months, to see if the height of the bone is at the normal level, because many times there is infection, or if there are biting forces which are beyond what is acceptable, then what tends to happen is the bone loss will go around the implants, and that might jeopardize the longevity of the implants. So if you ask me how long it will last, implants are there to stay for a very long time. It's very difficult to give a ballpoint figure, but as long as you take care of the implants and there is no infection, there's no excessive biting forces such as clenching of the teeth or bruxism, implants do stay for many years to come.
What's the correct age to undergo dental implant surgery?
Age is not a very important criteria. The key is basically you need to have sufficient amount of bone where the tooth is missing. As long as the bone in terms of quality and quantity is good, then your implants can be placed. However, when the very young age group, when you have still the baby teeth or when the permanent teeth are just erupting, we generally avoid placement of implants. We wait for the growth to complete. That's usually around 14 years of age. The other extreme age is in the very elderly people, the geriatric age group which we are talking about. Again, as long as the health is good of the individual, then we can still go and place the implants. My oldest patient is 92 years old lady. She came to us with all her teeth missing and was just not able to eat anything because the denture would not sit in the mouth at all. The jaw was so atrophic and was requesting for an implant rehabilitation. But she was in very good health and we placed implants in her. She's still alive at 96, 4 years down the line, and is doing extremely well and having a great life now.
Can dental implants be done for medically compromised patients?
One I can definitely say is patients with medically compromised conditions. It could be diabetes, and especially poorly controlled diabetics. There the implants may not get integrated into the bone. Well-controlled diabetics, yes, you can definitely do it, but the success of osseointegration may be slightly less than the general population who has not got diabetes. We generally say the success with implants is in the range of 98 to 99% worldwide this is. And if you are diabetic, then the success might come down to probably between 90 to 95% in the well-controlled age group we are talking about. The other risk factor which is really detrimental for the success of implants is basically smoking. Smokers again have a higher tendency for rejection and infection. So if you are a smoker, then the success probably is again between 85 to 90% with implants. As long as you're generally fit and the physician gives the clearance for us to go ahead with the implant treatment, even if you have had a cardiac issue such as a myocardial infarction, it's heart attack or angina or a pacemaker, it's really not an absolute contraindication. However, we do, as specialists in maxillofacial surgery, we do extra care, taking care of your whole experience during the surgical period, and that's where we work very closely with your physician, make sure that you are fit enough to undergo the procedure, and then only we would basically venture out to place implants in your jaws.
Are dental implants expensive?
Cost-wise, if you say the entire treatment, dental implants are much more expensive than the rest of the treatment because these implants are very, very high quality titanium. Pure medical grade titanium are expensive. So yes, these implants and then the lab work following the placement of implants are also expensive. So yes, dental implants are much more expensive compared to root canal treatments and routine crowns.
Do dental implants improve quality of life?
Of course, dental implants can revolutionize and by a huge extent improve your quality of life. With dentures, if you really talk about the chewing efficiency, with natural dentition, the chewing efficiency is probably between 300 to 400 Newton centimeter. With a conventional removable denture, the chewing efficiency is probably 1/10 of that. And with dental implants, fixed options, it's almost in par or probably even better than your natural dentition. We are again talking about 400 Newton centimeter of forces which can be. And the discomfort associated with dentures is very significant. The social embarrassment when it becomes loose and you're in a function, your dentures are wobbling, difficulty in speech, the difficulties in chewing, phonation becomes a major problem, and chewing becomes a major issue with conventional dentures. These can be completely taken care of with dental implants, and with the fixed solutions which we have there, your quality of life becomes extremely good. So that makes a huge difference to your